Good morning. Welcome, everybody, to this press briefing by the European Centre for Disease Prevention and Control. My name is Andrea Nilsson, and I will be moderating. Today, we are marking the beginning of European Immunization Week 2024, an opportunity to raise awareness about the importance of vaccination and immunization to protect lives. Please remember that this press briefing is being recorded and will be made available on YouTube after it has finalized. I have with me today Dr. Andrea Ammon, ECDC Director, and also Dr. Sabrina Bacci. She is the head of section for the Vaccine-Preventable Diseases and Immunization at ECDC. Dr. Ammon, please go ahead.
Thank you, and also good morning from my side. Thanks for joining this press briefing. As Andrea Nilsson said, the European Immunization Week is a good opportunity to reflect on the monumental impact vaccines have had and continues to have on generations of people in the EU and also in the world. Vaccines have been a cornerstone of public health efforts for decades, protecting individuals from infectious diseases and paving the way for healthier and more prosperous societies. Looking back to the 1960s and 1970s, it was the first time diseases like measles, mumps, or polio started being brought under control. And smallpox could even be eradicated, with the last case seen in 1977. Diseases that used to claim countless lives and leave many more suffering from debilitating disabilities were finally preventable. It was during that era when routine immunization programs emerged and countries started large-scale vaccination programs offering protection to entire societies against deadly pathogens. Through concerted efforts and widespread vaccination campaigns, we saw a dramatic decline in the incidence of once feared diseases. Children who once faced the threat of paralysis from polio could now grow up healthy and strong. Families no longer had to live in fear of losing loved ones to measles. Vaccines truly revolutionized the landscape of public health, saving lives and preventing untold suffering. But the story of vaccines does not end with the triumphs of the past. Today, we confront new challenges, such as new diseases or resurgence of diseases we thought were under control. And so the importance of vaccines remains as crucial as ever. Unfortunately, currently we have stark reminders that we must not get complacent. According to the latest ECDC data, we are seeing an increase of cases in several vaccine-preventable diseases, such as measles or pertussis. After having observed decreased levels throughout the COVID-19 pandemic years. In the EU-EA, measles cases began to steadily increase in 2023 after a period of low activity in 2020 to 2022. During 23 and 24 and the early months now in 24, while many EU countries continue to report sporadic cases, measles outbreaks have now been reported by some countries. Between March 2023 and February 24, so over a period of a year, there have been at least 5,770 measles cases reported by EU-EEA countries, including at least 5 deaths. For pertussis, preliminary data indicates an over 10-fold increase in the number of cases since mid-2023 compared to data from 21 and 22 in several of the EU-EA member states. Infants and young children who are too young to be fully vaccinated have been particularly affected, including several deaths. But cases are also observed in older children, adolescents, and older age groups. The measles and pertussis outbreaks are just two examples that despite the dramatic decrease in cases and mortality over the past decades, different vaccine-preventable diseases continue to circulate, and they still inflict suffering in those unprotected or especially vulnerable of all ages. And I want to emphasize here that vaccines are not just for children. They are essential for people of all ages. From infants to the elderly, vaccines protect individuals at every stage of life against infectious diseases and their devastating consequences. As we age, our immune systems weaken and make us more susceptible to infections. Vaccines against diseases such as influenza and pneumococcal vaccines help strengthen immune defenses in older individuals, reducing the risk of serious complications and hospitalizations. Additionally, we have now vaccines that reduce the risk of developing certain cancers. The HPV vaccine protects against human papillomavirus infection, which is linked to the development of cervical and other types of cancer. The hepatitis B vaccine protects against infection with the hepatitis B virus, which is linked to liver cancer. Furthermore, vaccines protect vulnerable populations who may be unable to receive certain vaccines due to their age or underlying health conditions. Through community immunity or herd immunity, widespread vaccination not only shields individuals who are vaccinated, but also help protect those who cannot be vaccinated, such as children too young to be vaccinated or individuals with compromised immune systems. As we look in the future, it is essential that we continue to champion the importance of vaccination and ensure equitable access to vaccines for all. We must also continue and intensify our efforts to understand and address factors leading to lower vaccine acceptance and uptake, including misinformation and disinformation about vaccines, which pose significant barriers to achieving high vaccination coverage rates. So to close, let me affirm ECDC's commitment to continue to promote vaccination as one of the most powerful tools we have in safeguarding public health. Vaccines have protected generations of people, and they will continue to do so for generations to come. Thank you.
Thank you very much, Dr. Ammon. Now we go with Dr. Sabrina Bacci. She is the head of section for vaccine-preventable diseases and immunization. Sabrina, please go ahead.
Thank you. European Immunization Week is always exciting for us working on vaccines every day. That's because every year, European Immunization Week is truly a celebration of the immense value of vaccination. Year passes by, and vaccines continue to protect us throughout generations, both classic vaccines and new ones that are becoming available and help us to increase the number of vaccine-preventable diseases. During my intervention, I'd like to particularly focus on two vaccine-preventable diseases we have seen increases for in recent weeks: the recurring measles outbreaks in the EU and a recent increase in pertussis cases. Let me start with the measles situation. Measles is a serious disease. It can cause blindness, deafness, neurological disabilities, and even death. One person with measles can even make between 12 to 18 others sick with measles. The European Union is now facing an increase of measles cases from 2022, when we observed less than 200 cases, to the last 12 months, when almost 6,000 cases have been reported. The highest burden is on the infants below the age of 12 months. These are the most vulnerable in societies because they are the ones that are yet to be young to be vaccinated and are those who would die from measles. We must protect our infants by ensuring that all those around them are vaccinated. A vaccination coverage of at least 95% of eligible population with 2 doses is considered optimal to stop the transmission of measles in a community. According to ECDC data, 90% of measles cases are within unvaccinated people. Data also show that 1 out of 4 measles cases are adults. These are adults that have missed the opportunity to vaccinate. Measles vaccines are some of the most effective, safe, and accessible vaccines that we have available in the national immunization programs. Measles is a disease that we can really control with high vaccination uptake. Many countries around the world have been able to eliminate measles and reach and sustain high coverage. Yet only 4 of the EU countries have reached the 95% elimination target for measles, according to the latest data we have. Another challenge we faced recently is pertussis outbreaks. Pertussis causes a strong cough, which is in the most vulnerable, it inhibits the ability to breathe. One infection can cause between 12 to 17 other new infections. So once again, a highly infectious disease. Pertussis in the EU is now showing a 10-time increase in 2023 compared to the previous year, and 2024 has started to show similar trends already, with preliminary data showing 35,000 cases in 2023 and 25,000 in 2024. Again, newborn babies and infants suffer the most severe consequences, with at least 11 cases of death having observed in this group in the EU in 2023-24, according to preliminary data. These are preventable deaths. We also see a high incidence in adolescents, with preliminary figures showing that 1 out of 4 cases reported is an adolescent. Even though we know that cyclical outbreaks of pertussis are to be expected, what we can do is to strengthen timely immunization against a vaccine-preventable disease. Pertussis vaccines are safe and effective, and that's not just for the vaccination of children according to national calendars, but also for expecting mothers who are often recommended for pertussis vaccination during pregnancy. Vaccination during pregnancy allow mothers to protect their newborn babies in their very first months of life through antibodies that they can pass on to their babies. Both timely routine immunization and vaccination during pregnancy are safe and effective strategies to curb the disease in the most vulnerable ones. In order to protect us and those around us, vaccines must be taken on time. Every country in the EU has a national immunization schedule that is designed to ensure protection for a child, a teenager, or an adult when they need it the most. The schedule and timing of the schedule is based on how our immune system responds to vaccines at various ages and when we are at most risk for disease. Decades after their intervention, vaccines are still today one of the most life-saving public health interventions. Let's all do what we can to prevent the preventable.
Thank you very much, Sabrina. Now we open the floor for questions. Please use the raise hand function or write them in the chat and we'll give you the floor. Please remember, when taking the floor, turn on your cameras and state your outlet. Let's see. Okay, we can start with some of the questions that we received offline. The first one, why do we see these increases for these 2 diseases right now, for measles and pertussis? Andrea, would you like to start?
Yeah, I start. So these increased levels for actually for both diseases have been observed not only in the EU/EA but also worldwide, and they are likely linked to several factors. One is the lower disease circulation during the pandemic years. Combined with sometimes suboptimal vaccination uptake, also in the same time frame, and then with immunity that declines over time. The vaccination coverage have also already shown before in the childhood programs a small decline in the third dose for the pertussis, and the maternal vaccination programs that Sabrina Bacci mentioned have a moderate to low uptake, although they're offered in 22 EU countries. So and it's similar for the measles. So it's a combination of factors.
Thank you very much. Sabrina, would you like to compliment? Good. We have a question from Catherine from Euractiv. Please, Catherine, the floor is yours.
Hello. Whoops. Well, I suppose. Hi. So I was just wondering if you have a clear picture. I mean, in terms of your role, I mean, obviously you're quite a small organization in the sense you can't take over public health messaging across the EU. But I mean, can you say something about who is performing well in getting this message across on the need for immunization? And is there best practice that's out there? And also, if you could say something about which are the groups that are proving the hardest to reach. I mean, obviously, it's particularly worrying in terms of young mothers or young families thinking about vaccination. And there's a lot of misinformation out there. So, what have you been able to do, or what in terms of addressing that? Thank you.
Yeah, so in terms of our work to support the countries who actually in the end have to deliver the messages and do the campaigning, we help them, for instance, with the overall European data analysis. We do vaccine effectiveness studies to bolster also the messaging. We have material that they can use and modify for their campaigns. And we have, together with the European Medicines Agency and the Commission, a portal that the European Vaccination Information Portal, that where you find for a whole variety of vaccines, the information on the vaccine, their benefits, their side effects, and how vaccine safety is measured, and also the vaccination schedules of the countries. So that's one part. Can you just repeat the second part of the question, please?
Yeah. Whoops. So yeah. So just if you've got a sort of, I don't know, a demographic picture of what groups are particularly excluded.
The groups, yeah. So I think that varies a bit in the countries, but usually it's those groups that in general have difficulties accessing the health system due to language, due to the socio-economic situation, or other parameters. So these are the groups that also have a higher skepticism against vaccines. and have more difficulties accessing the health systems. So these have to be considered in the vaccination programs particularly.
Good. Thank you very much, Catherine. I don't see any hands up right now. So let's go with the second question we received online. In a recent ECDC document, it was mentioned that pertussis outbreaks can also occur in countries with high-level vaccination. Does it mean that the vaccines are not effective? Dr. Bacci, please.
When we are talking about pertussis, we have to remember that the main objective of pertussis vaccination program is to protect those at most severe risk of disease. So as mentioned, these are the infants, and especially those too young to be vaccinated with the first doses. And we see this indeed. The majority of deaths linked to pertussis are occurring in these very young children. And these are also the ones who are most often hospitalized for pertussis. So this is our focus. And it's also true that sometimes some groups may miss and not have received the full vaccination doses. And this, of course, can have less contribution to the overall vaccination strategy. Pertussis vaccines are safe, and but they are not 100% effective at preventing infection. So it's also important, again, to think about the strategies for protecting the very young ones. These are the pertussis vaccines administered in pregnancy, and also, very importantly, a timely administration of the first pertussis containing vaccines to the infants. Complemented also with the childhood and later in life program that can contribute to the decrease of pertussis circulation in the population.
Thank you very much, Sabrina. I don't see, okay, we have one question in the chat from Romain from MedEquality. Romain, please, can you ask the question with the camera on?
Yes, hello, Romain Loury from MedEquality. I just had a question about diphtheria and pertussis rising at the same time and reaching both higher levels than pre-pandemic. Can we explain this fact that by the fact that these two diseases are targeted by the same vaccine? And are these the same populations affected by these two increases? Thank you.
Okay, Sabrina, please go ahead.
Thank you. Yes, it is correct. In 2022, we have observed an increase of diphtheria cases in the EU. Most of these cases were diagnosed as cutaneous diphtheria, and also were diagnosed in younger populations. With many of these cutaneous diphtheria probably having been infected outside the EU. So this is the type of pictures we have seen for diphtheria, and in the data from 2023 that we have seen actually a decline of this cutaneous diphtheria reported. For pertussis, it's a different epidemiological picture. Actually, we are seeing pertussis circulating in the population. We are seeing pertussis circulating in adolescents, and then, of course, affecting other parts of the population as presented. Yes, so they are part of the same vaccine, but actually the epidemiological picture is different.
Good. Thank you very much. Let's see if you have any further questions. We give a few seconds. Okay, I don't see any other hands up or anything in the chat, so we can close today's press conference. Thank you very much for joining and for your interest on ECDC. If you have any further questions or comments, please do not hesitate to reach out to us at press@ecdc.europa.eu. Thank you very much, and until next time, bye-bye.